a real interesting program, even for me. So I invited Stephanie and Melissa and Jeff to come because I get a lot of calls from clients and prospective clients who are looking for facilities and places for mom or for dad, and I see them really be frustrated by trying to call up this place and that place and the other place and try to get quotes and try to understand what's going on. And it reminded me a lot of what I do with insurance, because I do represent multiple carriers, and yeah, I do have my favorites, just as these specialists do too, but it doesn't make sense for you to go to one insurance company, get a quote, and go to another insurance company, because that company is going to sell you what they want to sell you, or whatever the product of the day is. And I think that a lot is true with these facilities. So it's important to work with that specialist who is the broker, who can give you some objectivity, and of course not charge you for those services, because that's exactly what we do in insurance. No one ever gets charged for the service that I offer, because I get paid by the insurance companies, and they get paid by the facilities that want those residents to come in. All right? Before we get started, I do want to make a couple announcements here. Next month, we do these almost every month, will be Wednesday, August 20th. This will be Navigating the Medicare Maze. And this will be Cambria Smith. She'll be coming back probably the third or fourth time now to sort out all of your Medicare options, whether it's Medicare Supplement, Medicare Advantage, what to do, when to do it. It's one of the best attended events. We may even have a double room for that event. But mark your calendars for Wednesday, August the 20th. In September, don't have a date yet, but it'll probably be around the 20th. I'm inviting Chef Maureen Shanahan to come in, and she's going to be talking about food. Anybody like food? I love it. And then in October, we'll have another event. We'll have another speaker for October, but I did want to mention kind of a separate event. And now, some of you already know that I'm also serve as president of the American Parkinson's Disease Association Georgia chapter, and every year we have a big fundraiser. We have a couple fundraisers, but our big event of the year is the gala event, and this year will be on Saturday, October 11th, the second Saturday of October. The weather will be beautiful. We have a sky deck rooftop venue overlooking downtown Atlanta. It's in Atlantic Station, and for more information, just go to apdageorgia.org and you read all about it. It's a fundraiser, and if you don't come, that's fine. And if you know someone who may want to work be a sponsor for the event, please give me a call, and I'll be happy to visit them and get them signed on. It's a great cause. We do a lot of fundraising for a couple things, mostly research, but then also our patient-centered programs here in Georgia, and those can be things such as caregiver respite programs, exercise programs. We have a caregiver timeout program with the Alzheimer's Association that they run that for us. Senior services at Fulton also receive some of our funding. And we have got a big push on this year to do a lot of exercise programs, because we've discovered, neurologists and everyone in the Parkinson's community has discovered that the best treatment, one of the best treatments, most cost-effective treatment for Parkinson's is exercise, and exercises of all types. So that's what we do at the Parkinson's Association. That is a volunteer position for me, by the way. It's all ad honorem, but my real job is what I do is, of course, long-term care funding solutions and a lot of life insurance as well. So let's get on with the program here. I have just welcome. Years. I have just in management positions at Merrill Gardens, Emeritus, and Alter Care of Ohio before joining Assisted Choice as a family advocate in 2013. So without further ado, Stephanie will tell you exactly what facility she would go into tomorrow if she had to. Just kidding. Welcome, Stephanie.
Thank you, Eric. Well, thank you for the opportunity to be here today, and hopefully you'll walk away with much more knowledge than you came in with today. That's my goal. So we'll do an overview of the options, and then I'll leave plenty of time for a lot of questions and answers afterwards as well. what I'm hoping that you'll take away from today is understanding the different types of options, anything from independent living to nursing homes, the different types of assisted living and regulations with personal care homes versus assisted living, and how to define those, how the state defines the two regulations between those. The key factors in selecting the correct option, and also the complex pricing models that are included with the assisted living and personal care homes. The medical evaluation forms, which is a required form on the state that will go through and how that would affect the cost of the care plan in assisted living, and then the different types of care sources as well. It's very overwhelming. There's so many different options out there. You know, you start with the senior apartments and 55 over, independent living and home care, personal care, assisted living, continuing care, and nursing homes, which is a pretty wide range to choose from, and not knowing where do you start and which one is going to work. So I'll be defining all of those today as we go through. So senior apartments is going to be like an apartment complex with no services offered. Some of those are going to be age restricted, but you're not going to have the meals and transportation that you're going to find in an independent living community. So that would be the kind of the next tier of what you would go to. The independent living communities, and there's some are age restricted to 62 or 55, and some are 65. But the independent living communities are generally going to include meals, 1 to 2 meals. They'll have a meal plan option. They will include your utilities. Some include cable, and then they have transportation services. But it's more offered for a lifestyle. But you do have the option to bring in home care or home health services into the independent living because it's not a licensed facility through the state. It operates similarly to an apartment complex, but offering a lifestyle and the meals. And you do have staff there 24 hours a day, so you do have some sense of security. And then you have the home care, as I mentioned, that you can bring in to the independent living. But I want to just touch for a moment on the difference between the home health and the home care. So home care is going to be private pay or covered by long-term care insurance. And then you have home health, which is generally used on a short-term basis covered by Medicare for skilled services. So you would need a doctor's order for home health to cover that. But home health can come into independent living, into an apartment, or assisted living, or your own home for that matter. I thought this was an interesting article and just an overview of, from the Wall Street Journal that shows the average cost of assisted living state to state. And so in Georgia, you have, in comparison with everyone else, it's a little over $3,000. The average stay in assisted living is 28 months. That being said, it's an $87,000 decision. And what I say to my clients and when I'm educating them is, when is the last time you made an $87,000 decision and didn't do your research? And most folks do wait for that crisis to occur. It's a big decision, it's a costly decision, and waiting till the last minute for that crisis is not the best thing to do, but most often what happens. So
now this $3,077 a month, which one of this previous facility were you suggesting that cost?
It's kind of an average of the base rate.
it's an average in the state of Georgia for the base rate. For assisted living.
I don't know which,
For
if we go to previous chart, which one of those three does it affect?
Oh, we're going to get into assisted living next. So that was just showing you the average cost, but if you go to the next slide. Okay. So this is where I'm going to tell you about personal care home and assisted living, which is what that average cost is for. So I'll go ahead and define
That
those.
wasn't on the first chart.
Okay, right. So the areas of comparison, personal care home, they're licensed differently, although if you were to drive by them, you would not know the difference because from the outside they're going to look the same. But you have, if you become non-ambulatory, and you become bedridden, you're not able to propel a wheelchair, you have to get permission from the state and receive something called a waiver to be able to stay in a personal care home. They only allow up to 3 waivers in a personal care home. So you also may be asked to leave at some point to go to a nursing home or other care options if you're no longer to meet that requirement in a personal care home. With the new licensure that the state's offering as an assisted living, which everyone has also kind of called most facilities as assisted living, this is actually a new license type. So You don't have to apply for a waiver and get permission to stay in a facility if you become bedridden, non-ambulatory, and don't meet the requirements of that personal care home. You can stay in assisted living long-term. So essentially, it gives you the ability to age in place and have that continuum of care and not have to leave and go to a nursing home. Also, one of the other major differences is with medication management and administration. There's a big difference between administering and just assisting someone with medications. So back to the personal care home, the staff can assist you and hand you your medications, but you would have to take them yourself. They cannot administer them to you unless, this is where it gets confusing, you are a dedicated memory care community. The pills can then be offered by a nurse in that facility, but only if it's memory care in a personal care home. So we can come back to this. I know you guys may have questions at the end about some of the regulations and defining these two. But in an assisted living, they can administer if the staff are trained appropriately as a certified medication aid. They do allow you to administer medications versus just assist. The other option I would really wanted to talk about is the CCRC, Continuing Care Retirement Community. So this is generally a buy-in community where maybe you would put down $200,000 up front and still pay a monthly rental fee every month. But the benefit of a CCRC is also having that continuum of care, meaning you have the independent living, assisted living, and nursing homes. So you age in place, it's all on one campus, and you stay there through life. And then you have nursing homes. And you have different types of nursing homes offered. You have long-term care nursing homes, and you also have the ones that offer short-term rehab and skilled services. So that would be, you break your hip, have a stroke, something happens, and you need to go in for physical therapy and rehabilitation. You go there on a short-term basis, and Medicare covers the cost. Now, for long-term care, you have private pay source, and you also have Medicaid. Some of the facilities are Medicaid. You can stay there long-term. So now that we've talked about the different types of options that are offered, there's several key factors to consider with all of these options out there. So not only do you have all these options, now you have some factors to consider. One is cost. That's generally the most common factor we're all going to consider. You know, can I afford $1,000 a month, or can I afford $7,000 a month? Where do you start? And I'm going to go over that on the next slide. We'll get there in a moment. But personal care needs. So figuring out, do you want to go somewhere where you have care offered immediately, and what type of care services do they offer? And what is the cost of that care? Because that's going to vary at each community. Location. So I've had clients before that want to be in Buckhead, but it maybe cost them $5,000 a month, but you can get that same thing in another city 20 miles out for $3,000 a month. So think about what location you want to be in, and how does that correlate with the cost and what your budget is. Age restriction and requirements. Look into that as well. If you're looking for yourself early on, some communities have them, some don't. But I mentioned this earlier. Some are going to have a 55 age requirement, 62, 65, and others don't have one at all. But it is something to consider. Social needs and interests. Some communities are known for offering a lifestyle, like a cruise ship, and they have a lot of activities. It's very social and very active. You have other communities and companies that are known for the quality of care that they provide. They don't so much focus on a lifestyle and how active the residents are. You may walk in and there's your residents there that need a very high level of care. Those companies are very good at providing that level of care, but which type of environment are you ready to go in more of an independent or an active assisted living, or going into assisted living that can really care for you through the end of life with that assisted living licensure, but you're also more likely to go into a higher acuity environment, meaning more folks there that have higher care needs. Continuum of care is something to consider as well. So again, if you go into an independent living community, at what point would you need to leave? Well, that's kind of unknown. You can always bring those services in. They do have staff 24 hours a day. But if you're bringing in the services, it can get costly. On top of the base rent, now you have home care services on top. So does it make sense for you to be an assisted? Do you want to be in a community that offers independent and assisted? Do you want to be in a community that offers independent, assisted living, and memory care? Now we've just done one more option in. Or do we want to go straight into an assisted living community that's just assisted, or assisted in memory care, or that offers a nursing home as well? So you have the different facilities. Some have the continuum of care and others don't. Do you want to make another move once you need that care? So that's something to think about. You have moving expenses, but not just that, just the adjustment that you would have to make of going and selecting another facility, what's going to work for you, and having to just pick up and move and make all new friends and an adjustment. It's a transition. Pricing models in assisted living and personal care homes. This is very important to research and understand before you select an assisted living or personal care home. So there's 5 different pricing models just in the Atlanta market, and we'll go through each one. Scale points. So you have some companies that when they do their care plan and assessment of mom or dad and determine what do they need. Mom needs bathing 2 times a week, so that may be X amount of points, maybe 10 points. Well, how often does mom bathe? 2 days a week. So then you multiply the points together. Well, does she need medication management? Be another 10 points. And they also look at how often is the service needed. So for instance, with bathing, is it hands-on, standby, or total assist? They kind of have this breakdown of tiered services. So it's the frequency of the service and how much, is it hands-on or is it more of a standby? So you add up all these points and you come to your total amount. So you may be 30 points and could range anywhere from $600 to $2,000. The benefit of a skilled points community is if you don't need a whole lot of care, you don't have to pay for it. You're paying for the services that you're receiving. But if you need a lot of care, it can get very costly in a scaled points community. The points just keep adding up. In an all-inclusive community, the benefit here is if you need a lot of care, you'll pay one price. Let's just say, for example, $4,000 a month, all-inclusive. No matter how much care you need, you're going to pay this one flat rate. But if you don't need much care, all-inclusive may not be a really great option for you because, again, you're going to pay for services that you really don't need. And then you have multi-tier all-inclusive, where you may have a level of $4,000 a month includes X amount of care, maybe dressing and bathing. And maybe $5,000 a month includes transferring from the bed to the wheelchair, incontinence management. So it's almost like a higher level of care that you can get at another tiered level for an increased cost. And then you have a la carte, where you have flat rates for every service. So medication management is X amount. Assistance with bathing is X amount. And then you have outside contracted services. This goes back to the home care. And it's, some of the facilities offer the contracted services on site, where they work within the building or the facility. Others allow you to bring your own services in. This sometimes is an affordable way to be able to stay in independent living, bring those services in. So these are a lot of options to consider just when it comes to the care piece of it and how it would affect the financial piece. In medication management, this is an example of two local communities that are just a couple of miles apart from each other, and the way that they price medication management. So for the first assisted living, if you're on 1 to 6 pills per day, it's $375 a month. So the pricing per pill, not per pass. If you're on 6+ medications a day, $625 a month. But the property down the street for 1 to 10 pills is $550, and 11+ is $1,100, $105. It's a huge difference. So if you're on more than 11 medications, you save a lot of money going to property 1. And so each facility prices their medication management differently. this alone, knowing this information, could save you $5,700 a year. Just a little bit of information. Go ahead.
Does this include the cost of the medication or is it
No,
just-
this does not include the cost of the medication. That's a great question. A lot of facilities are going to have pharmacies that they contract with that they will either require you to use, or you can choose to use your own pharmacy, but they would require you to bubble pack or repackage the medications that you bring in to use to repackage them through their pharmacy. Now, that's if you're receiving medication management services from them. If you are managing your own medications, they generally do not require that. But going back to the way that facilities price medication management, some price based on number of pills, so how many medications are you taking per day? Some price based on how many medication passes do you have per day. So let's say dad gets medications 4 times a day. You can expect that that cost is going to go up. But there's ways to be creative with that. You could say to their nurse and talk to them and talk to dad's doctor. If dad's just taking some vitamins in the morning, and he's taking some other medications at noon, can we condense these medication passes and go from 4 medication passes down to 2? And would that affect him in any way? And if there's no side effects with that, that's not going to cause any harm, you could save yourself probably half the cost and bring that down. So this is very important. And when you get into diabetic management with medications, it can get very costly. There's only certain facilities that will offer diabetic management, especially if you get into a sliding scale diabetic management. There are very few facilities in Atlanta that offer it. And if they do offer it, it's costly. So you have to ask yourself, if dad's diabetic, can he manage his own insulin? They do the glucose, most communities do the glucose checks. But to do the insulin and the injections, especially with a sliding scale, there's very few that offer that.
Stephanie, a question. I think there are probably a lot of people thinking, gee, I could probably do this myself and I'll save some money. How important is that? And what is your experience with families who have tried to do that on their own?
So that's a really great question, Eric. That is an option. You need to ask permission from the facility, but in my experience, the facilities are open to allowing a family member to manage the medications and come in and do those. Or, they may set up the pill box for mom and she's able to take them on her own. But if she's forgetting to take them, that's where they may require you to use their service for medication management, as opposed to using a system or having a family member. But that's along the same lines of, if you wanted to save some money, save $600 a month and come in and bathe mom twice a week, most facilities will allow you to do that. So again, this goes back to kind of being creative with the care plan of how do you keep the cost down. And that's a really great option for helping with medication management, assistance with bathing. And I'm trying to think with the medication management, there may be some other ways to do that, whether it's a family member or the outside contracted services that we were talking about earlier. Some of the communities offer the on-site services that will charge you in a 15-minute increment to do medication management, which is really reasonably, priced to be able to do that as well. The physician's medical evaluation. I'm not going to spend a whole lot of time talking about this, but I did want to point it out. It's a state-required form before you move into assisted living or personal care home. Going into independent living or a senior apartment, they may require you to get a physical, but they don't require anything by the state because they're not licensed. However, so this form, what it's going to cover is your care needs, medications, diagnosis, and just 2 important things. It asks if you need 24-hour nursing supervision, and also if you need dementia care, if you need to be in a memory care. So they're really important because if the doctor circles one, that you need 24-hour nursing care or you need to be in a secure memory care, then the assisted living facility you're not going to be able to move in. And some of the physicians may not completely understand how that's going to affect their patient when they need 24-hour nursing care, they need that. When really, they don't really need 24 our oversight one-on-one, but more so just need, some to be supervised, not necessarily in a nursing home, but assisted living setting would work. So it's, I would encourage you to get familiar with this form and understand it so you're prepared. So the different payer sources out there, we all know private pay, long-term care insurance. It's good to know if your mom or dad have it, if you have it now for yourself, and what does it cover. Become familiar with the policy so you're not digging for paperwork when that crisis happens. Does it cover assisted living? Does it cover skilled nursing? Does it cover home care? And what is the max number of days it covers? What is the daily rate? It may be anywhere from $100 to $150 a day, and there may be a max period on it of 3 years or 6 years, but it's good to know those things before an event does happen. Veterans benefits are also something I would encourage you to look into. If you're a veteran, widow of a veteran, or a spouse of a veteran, there's some really great benefits out there for home care as well as living in assisted living to assist with the expenses. The aid and attendance program through the VA. So,
Are there income limits on those?
there
things?
are, and I want to say it's around 80,000 or less, not including your home or vehicle. But I would encourage you to go to the VA website and just check out what those requirements are, because there are requirements around the time served during the war period, income, expenses, and so forth. So, absolutely. Question. Medicare, going back to home health, Medicare cover home health. It's going to cover your short-term stays or hospital visit, skilled nursing or rehab for X amount of days. But I have folks call me all the time and they'll say, well, I have Medicare. Won't that cover assisted living? And Medicare does not cover assisted living. So just to be clear. Now Medicaid, there are some facilities out there. There are personal care homes and nursing homes that do accept Medicaid. There are several in the state of Georgia of the personal care homes, and I want to clarify, of residential care homes, because we really didn't touch on this. You have licensed facilities that are, 40 apartments or 100 apartments that are personal care. You also have personal care homes that are like a house. It's a residential house where you may have 6 or 8 residents living there. So it's another kind of a model, but it's under the same licensure. But some of those residential care homes, many of them are, they accept Medicaid. So that's good to know when it comes to income requirements. But there's also independent living communities out there in the senior apartments that are based on your income as well. Yes?
And just go either way. Long-term health care insurance. My policy gives an amount per day at a nursing facility, and half of that amount for home assistance. Do I burn up my number of days when I use the home health assistance?
Generally not. It's always up to that
It's up to the maximum.
daily maximum that they allow you. If you use less than the maximum, it's still there for you.
So I can, for instance, the policy goes 5 years at full rate, so that
At the
would,
full rate, right.
that would essentially blow out the 5 years to something else.
Yeah, you could extend it. Sure.
Okay.
Absolutely.
The long-term care insurance, if any of you have it or you're checking in to see if mom or dad have it, it's really good to look into it because some of them, they're all written differently. I've seen a number of things, the way it's written, where they may require a 24-hour nurse to be on site. They may refer to the care as custodial care. Some of the policies that were written years ago, there was no assisted living, so they just called it custodial care. So if you see something, that verbiage, that is generally referred to as assisted living, custodial care. And some of the policies just cover skilled nursing, and some just cover home care services. So that's really good to look into that and identify which one your policy would actually cover. So I think that covers all the financial payer sources. And that brings us to the paradox of choice, which I think is something kind of good that sums this all up, is this is very overwhelming. You can tell there's a number of options available. Don't wait for a crisis to happen. When you're in, when you have a crisis occur, and you have all these choices, you have no time, you just become overwhelmed, And it's hard to make a decision. You may just go with the first thing that you see versus knowing, okay, what's truly best. So we become overwhelmed and just make that decision versus really doing our research. Going back to, as I mentioned earlier, it's an $87,000 decision on average. And we make purchases every day. That's a pretty large purchase. It's significant. And I like how Eric compared this earlier to shopping for insurance. We all shop for insurance. Just things every day that you shop for, we all price it out. But does anyone do their research and price out and search and truly understand all the options out there with senior living options, which it's great that you guys are here today to educate yourselves and become familiar with those options, whether you're looking for something now or later. Very, very important. So, and I'm with Assisted Choice, and one of the services that we offer in helping folks really navigate through these waters and understand the complexity, educating you as I did today, but also figuring out, okay, based on your personal situation, what are the best communities that would match your needs? So there's over 400 communities in Atlanta. Where do you start? Start narrowing it down by the cost and the care needs. What area do you want to be in? All of the key factors that I mentioned earlier. Once we determine which options would be the best, review those together and go over them and determine which communities should we go out and take a look at. And so we have our family advocates that go with you, and they'll coordinate the tour of the property, go with you on the tour, and ask those questions that you may not be familiar with to ask about how long is the rate locked in at the community, and what is the average increase in your rate? Is it 3% or is it going to jump to 10%? And understanding how to review the contract, things to identify and to just understand and become familiar with, understand the pricing care models, and understand what kind of communication can you expect from the nurse. How often should you have a care plan meeting? What type of notice should you be given when the plan of care changes and the cost is going up? So this is that constant communication and understanding. Also asking the question, what are your staffing ratios? I think that's very important to know. The state staffing ratios are 1 to 15 during the day and 1 to 25 at night. So that's one caregiver for 15 residents during the day, 1 to 25 at night. And and this is for personal care and assisted living. Even though there's 2 different license types, they are staffed the same. However, they do ask in assisted living that you staff according to your residents' needs so you can safely care for them. So those are good questions to ask, because some communities staff above the state minimum staffing ratios. So they may staff at 1 to 8, especially in memory care communities, you'll see that. So instead of 1 to 15, they'll staff at 1 to 7, 1 to 8, and they'll also have specialized training. So, to ask that question as well, what is the tenure of their staff? What type of training have they gone through? What type, I think it's really good. I think the best way to really tell a lot about a community is by the residents and the family members. When you go and you tour communities, you can tell a lot just by looking at the residents and talking with them. Are they happy? And they'll tell you. You just have to ask, or just catch a family member in the parking lot and get their opinion. It's the best way I can tell you to ask around.
Stephanie, what's the single biggest mistake that families make in choosing a place for mom?
Not understanding when you make a decision, how is it going to affect you long term? Meaning, you go in now at a $2,500 rate, and that sounds great, but do you truly understand when dad needs care, what is the potential for that cost to rise? With the increase, the care plan, do they offer memory care? If the care progresses, can the facility, 1, can they handle it? And 2, can you financially afford it? So I think that's very important to plan for in choosing the right community, unless you are willing to say, I want to go to this community now, but if my care needs change, I'm willing to pick up and move to another community. So it's really just making an educated decision, which is so important, versus just going in and seeing the glitz and the glam and saying, this is really pretty. I like it. Seems like a great place. Go back a couple of times, try out the food. Have lunch, have dinner, bring your loved one, and talk to the residents. Really get to know the community. And I would go back more than one time, because you may have a first impression, but what is your second impression of the community when you come back? Is it the same feeling that you got from your first visit? And you can just talk to others. You can always check the online reviews, but sometimes that's not always the best way. You see a lot of the negativity on the online reviews versus positive comments and feedback. So I think that the best way is to really just talk to the residents and families.
Stephanie, can you elaborate just a little bit? I'm sure they understand the difference of assisted living versus having to move over to a memory care unit and why
Sure.
you need to be in that environment.
Sure, that's a great question. So some communities may offer all memory care, or they may offer assisted living, and then you progress and need memory care. So if someone has dementia or they have mild confusion, you don't necessarily have to move into memory care. But if you become that it's just unsafe for you to live in assisted living, and you're wandering, exit seeking, or just really confused, or need more one-on-one attention. Do you need a lot of prompting and cueing? If you're getting to go to meals, they will do prompting and cueing in assisted living. But you have to ask yourself, is there a benefit, to keep dad in assisted living and he needs prompted for everything he does? Is he getting the right oversight and attention he needs in assisted living? Because when you go into a memory care environment, I mentioned to you earlier, the staffing ratio is almost double in most communities. So you have a lot more oversight, one-on-one attention, but also the activities in the environment are going to change. So I've seen, families will come to me where dad's living in assisted living, but he's ostracized because he'll go down for meals and he can't have a conversation with anyone, or he's forgetful and he can't carry that conversation. And he needs the reminders to get to everything. And is that really a benefit to him in thriving in that environment? Or would he be better served in going into a memory care community where one, he gets the proper care, the oversight, but also the stimulation and the activities are going to be different in memory care.
Okay, I was looking at a place 3 days ago, and we're looking at assisted living. That's not going to be due until March. On the third floor, it's memory care. So she said basically you can't even go up there yet. So my question is, I was like, I got to call them and say, okay, if we're here on the first level, and in a year, 2 or 3, whatever, we have to go to memory care, will there be a spot for that? Is that something I need to look into and find out how that works?
Well, what typically happens, what you'll find with memory care, is that you don't have a wait list. It's not something that someone's planning for. It's generally crisis driven, or someone progresses and they need to move to memory care. What I would ask them is, one, be aware of the cost of the memory care, and ask them, do I need to have my name or dad's name on a list if we need to progress to this and get to that point? And are they already pre-selling it? Are they pre-leasing it? Because that's the question I would really want to know. If they're pre-leasing it and you have a concern with that now, I'd bring that up and talk through that.
Do these facilities have any kind of emergency medical assistance available in case somebody gets a heart attack or something of that nature?
Not that I'm aware of. So generally, like with the state regulations, if someone falls and hits their head, they're required, they call 911. And then they send you out to the emergency room. Even though the facilities have nurses on site, some have them 24 hours, some do not. They may have a nurse on call, but they're not able to provide skilled nursing services in an assisted living. But it is great if you have a nurse there that has a knowledge base to be able to make those decisions, but they can't act on it to provide skilled care. But I don't know of any emergency services, as you mentioned, that are offered. Generally, they're going to call 911 and probably send someone out if they need the medical attention.
Sir, of course, just by staffing, staff caregivers are required to have CPR and first aid certification. So they are allowed to do that with no legal ramification. I don't know what it's called, the do-gooder.
Good Samaritan
Good
law.
Samaritan law, thank you.
They don't have defibrillators or anything. They would just, initiate CPR.
Correct,
and
correct.
call
So
911.
they're trained in that, but
So if you fall and cut yourself, they're not going to suture you up.
Oh, no.
You have to go to the local emergency.
Like, you mentioned that diabetic care,
Mhm.
it's more expensive than other, and if somebody has an issue with respect to low blood sugar or high blood sugar or something like that, are nurses qualified to do that kind of work?
So generally, they will, you know, take your blood sugar, they can do the checks. Depending if the facility does it or not, you know, some facilities will offer the care of doing the insulin and kind of monitoring that, and others do not. But they generally know that on the front end, and will tell you that before you come into a facility, so you're aware if they can actually handle those care needs. Because if you're able to manage it on your own, and you get there, and then what happens if you get to a point that you can no longer manage your diabetic needs? Do you have to move out? Now, home health will come in, and I believe under Medicare, will train you on how to do it yourself, but I don't believe they cover it on a long-term basis. So home health can come in temporarily to help you with that, but not on a long-term basis. So if you're able to do it yourself, there's not gonna be a cost, but.
The nurses, though, in the communities, they have to provide watchful oversight and be educated. So I would be concerned if a community is willing to accept somebody with insulin and then does not have the knowledge to understand high, you know, symptoms of high blood sugar or a low blood sugar, and what to do in that situation. Typically, they're going to have some sort of protocol in place, and they get a lot of ongoing training